Since Labor Day here in Massachusetts, cases have increased by 7 times, and over the same period of time, hospitalizations have increased by 2 times. Today we have about 661 individuals in the hospital compared to about 178 on Labor Day. And the numbers clearly have been trending in the wrong direction since the end of summer. We've been talking to and working with our hospitals all the way through this exercise, dating back to last spring, and have been talking recently with them about treating an influx of COVID-19 patients. And last spring, among other things, we made the very difficult decision to have hospitals focus almost exclusively on COVID patients at the expense of almost everything else to ensure that we had enough capacity to serve those who had COVID. And as a result, over that period of time, there were many people who put off getting routine and in some cases serious medical care, which created a secondary problem. Since then, we've been working closely with the hospitals to work to prevent having a similar kind of circumstance play out here this year, and we believe that it's possible to create the capacity that we need here in Massachusetts to treat non-COVID medical care and COVID medical care as we work our way through this surge. Hospitals are currently operating at about 73% of capacity, and ICU capacity, this is overall, is at about 50%. The hospital community is prepared to make an additional 400 beds available on their own by converting acute care beds into ICU beds. And last spring, I think as people know, we stood up about 5 field hospitals, which had a total of about 1,000 beds between them. These sites serve as space for patients needing a lower level of care so that more seriously ill patients could be treated in the hospitals. Over 700 patients were served between the sites at the DCU in Worcester and at the Boston Hope site in Boston, and 3 of those field hospitals were ultimately not used in the spring. We're announcing today that we're going to reestablish a field hospital with 240 beds at the DCU Center in Worcester. MEMA and the Command Center have activated plans to mobilize that site, and we expect it to be available for patients if needed by the first week of December. The National Guard, as they did last year, will support the setup of this facility, and UMass Memorial will serve as the clinical partner for the site, which will be staffed by professionals from their team. The Command Center and MEMA are continuing to have discussions with other hospitals and local officials to identify other locations for field hospitals if they're needed.